Well, good afternoon or good morning, depending on where you are. So we are going to present a proposal from our group of how we can collaborate with IHCC in order to help low and middle developing countries development and development of their cohorts. So can you put the first slide, please? Okay, so this is the aim, to increase scientific productivity of our countries. And our challenges are that we need a highly trained human resources to help analyze the wealth of data that is produced in our cohort. Unfortunately, the funding for science is so minute in our countries that most of the resources we use to raise the data, to take the samples, but we don't have resources for the analysis and especially for the writing, the time that we need for writing. So we thought that the ideal, an opportunity for us that will get the most benefit in our population and in our scientists is to have an interchange, not only from us going to developed country, but from a well-informed person in developed countries to come here. So then he or she will help and accompany many of us, improving even our language, our English. So that's why I think the benefit of bringing young scientists to our places is much larger and important. So our next slide, please. So our proposal has the idea that we offer our countries, our cohorts can offer something. So the idea is that we will present what we can offer, and we hope that IHCC can also accompany us, partner with us to increase, for instance, a salary for a young scientist. So what we have in MAUCO, in our center, MAUCO belongs to a research center where we have competitive funds for postdoctoral training. That includes a monthly salary that I'm sure is too low for an international student, but that's why we need a matching with IHCC. And we also have small research grants to help analyze data already collected, things like that. And we offer a lot of training opportunities in our master's or PhD programs, both in Catholic University and University of Chile, that are the largest research universities in my country. Both we are partners in this MAUCO. Also, our third partner is a university from the Maule region, and they also offer sleeping accommodation, food allowances, etc. So we will have an infrastructure to receive young scientists, and what our expectation is to have a scientist that has a PhD, that have expertise in statistics, that manages Air studio, Air program, and have scientific writing skills. Because what we want is to have that each of these the scientists will produce at least one manuscript and one research proposal to further collaborate with us in MAUCO during his or her fellowship. Next, please. So now each of our colleagues will present three areas in which they offer opportunity for a young scientist to come visit us. Pablo, next, please.
Thank you very much. It's a really pleasure to be here and present you a little bit about our cohort in MAUCO cohort. Well, I'm a psychiatrist. I did my doctoral thesis in cognitive disorders and aging. So that's the theme where I like to work, and I would like to have the the help of somebody to analyze our data. We have many data collected at MAUCO. It's about 10,000 persons where we have baseline data from 7 years, 8 years ago, and we have been following up these persons. And there are so many important data which we have to consider in aging. For example, all the variables associated with major chronic diseases, diabetes, hypertension. We have medical information, weight, health, eating habits, and all these medical data are very valuable thanks to the fact that we also have the baseline measurement of cognitive status with a complete neuropsychological battery. The Addenbrooke's cognitive examination, which allows us to obtain separate performance by cognition domains. And to that, all participants were asked if they had cognitive complaints by any means of a questionnaire applied in the baseline examination. We examined adverse events and history of depressive symptoms, and these are all also part of the data collected. Therefore, we have basal information and in the follow-up of 7 years, and that allows us to characterize different aging trajectories and study which medical and social variables condition this aging. If you age healthy or you age, for example, with a cognitive disorder, with a depression. And one of the most interesting variables to characterize is that of cognitive reserve. But this has not been done in subpopulations where education and socioeconomic level are as variable as it can be in our study population, rural and within with a large proportion of people with low education level and low socioeconomic level. Finally, the entry of the pandemic, the COVID pandemic, as an aging trajectory modifying event will undoubtedly be an important source of study at MAUCO as well. For example, characterizing different trajectories of aging and post-infection cognitive changes. That's it. Thank you very much, and please consider to come and work with us.
Thank you, Pablo. You should mention that we also have a biobank.
Oh, yes.
Yes, for these individuals and some clinical measurements. Okay, very good. Andrea or Sandra, who's best? Next, Sandra. Please, Sandra.
Thank you so much, Caterina, and thank you for this opportunity to share about our work. My name is Sandra Cortez. I am veterinary doctor, and also I have a PhD in public health. And I am the person in charge of the environmental and occupational exposures in MAUCO. And so my big interest is to explore the relationship between the different exposure in the workplaces and also at environment exposures related to pesticides and air pollution inside the participants of MAUCO. And we are interested in to have some students working on metabolomic markers for chronic disease related to this kind of exposure. They are very prevalent in our study area. And also, we have some special interest in studying the relationship between climate change and health to level population. And so we have some experience using the MAUCO Cohort as a sentinel center for COVID-19. And also we have the opportunity to analyze different environmental information related to climate change using this platform, and explore, for example, the importance of the geographical analysis, especially related to the use of pesticide and other environmental information. And so we are very interested in have this opportunity of training people from other countries, especially attending our courses in environmental and occupational epidemiology, working with data analysis. And especially, we have another interest in some specific areas in our country where they show high damage in environmental conditions and social impacts and health impacts. And the people from these areas use the denomination of sacrifice zones, especially related to industrial areas or some specific emissions from different activities. And so my interest is to visit this area with students from other countries and explore new opportunities to research in these situations that are very important in our country, related, for example, to mining activities, agricultural activities, or other industrial areas. Thank you for me.
Thank you, Sandra. Very well. So we have a completely different area here. And now, Andrea. Thank you.
Yes, hello, my name is Laura. Thanks a lot for inviting us to this summit. Thanks especially to Katerina for inviting me to work with this incredible team in MAUCO. I am a physician. I'm a specialist in nutrition and metabolic diseases, and I have a PhD in epidemiology and public health from London School of Hygiene and Tropical Medicine. Since I live in Talca, that is 30 kilometers from Molina, where MAUCO Cohort is held, Katrina invited me when MAUCO was starting in 2012. So I'm working there as the local epidemiologist since then. I also impart classes at medical school in Catholic University of MAUCO, located in Talca, of Maule, I'm sorry, of Maule, yes, of Maule, located, which is located in Talca. And I work as a physician attending patients with malnutrition and diabetes. Therefore, my areas of interest where I would like to come postdoc to work here are metabolic diseases, including obesity, insulin-resistant, diabetes, non-alcoholic fatty liver disease, and liver disorders, lipid disorders as well. And I'm interested in lifestyle and protective factors for cardiovascular diseases, and also in health obesity. I'm not sure if it's true or reality. So we have here a lot of obesity, high prevalence of obesity and cardiovascular diseases. So it's very interesting to study these risk factors. And we have, beside the biobank, we have already nutritional data, body composition, lipids, liver enzymes, ultrasound of the liver and gallbladder, and also in a few of the participants, we have measured fibrosis, liver fibrosis through the fibroscan. So we have a lot of data, but beside this, candidates here, we are in the field team, candidates training who want to work with these proposal lines will have the opportunity to work with their team, the professionals and technicians, and also see our collaborative work with local institutions like the municipality of Molina, Molina's hospital, and some community associations. They also will have the experience to witness the awesome relationship between the community and MAUCO team, which I think is one of the most remarkable characteristics of MAUCO Cohort. Finally, candidates could attend some courses at the university here in Maule, Catholic University of Maule, and Catholic University of Maule will be willing to pay for your air ticket fees. That's it for my part. Thank you so much.
Thank you, Laura. Excellent, very attractive. So now, next slide, please. And this is the last. My background is also I am an MD, and I began my career as an infectious disease epidemiologist, and then I moved to cancer. And in cancer, I work infection and cancer and also environmental cancer. So I will be happy also to receive anyone interested in cancer research. We have a research line from basic science to the work in public health and epidemiology. And we'll have the opportunity to visit another site where we have a cohort of women with gallstones. This is the region with the highest Amerindian Americans in Chile. And they also have the opportunity to work in Molina. Okay, this is it. And next slide, I don't remember if I have another. Yeah, this is that's our field team, the local technician that does that process the samples for the biobank. And below is the Molina Plaza. Thank you very much. And I hope that we get proposals from IHCC members. Thank you. I'm not sure if there are questions or comments, reactions.
Feel free, anyone, to unmute yourself and ask questions that way. This is meant to be an open discussion as well.
Okay, if can I start, Carly? I have a question.
Okay.
Or Catherine. Okay.
Yes.
First of all, thank you, Dr. Katerina, for this a great presentation from you and your team, and for sharing with us this proposal that maybe we can use from IHCC as a model in order to support our mentorship program. Sorry, by the way, I didn't introduce myself. I am Dr. Latifa El Hadri, and I am IHCC. I work with IHCC as a project manager, supporting the training and workforce development working group and the policy and system working group. Thank you, first of all, as I mentioned, to you and to your team for sharing with us the possibilities of receiving some postdocs or young investigators in order to learn from you, from your expertise and from your experience. At the same time, you learn from them, and at least you can have one publication. So as you know, in our situation, we don't have funding for the time being. However, we can do something virtually. So is it possible to do some mentorship virtually? That's one thing. And the other thing is what is approximately the cost to get somebody on board at just approximately, in order, if you have somebody who's interested to work with you, or to work with Pablo, or work with one of your team in their area of interest, so we can give them an idea or have an idea about how much it's going to cost us. Thank you very much.
Oh, thank you, Latifa. Well, first is, yes, we can do virtual. It's not ideal. Will be because virtual, people is shy with the English, so they will not make questions probably that they could in person. So there is something there. I see when I finish a seminar in virtual, then people ask a question when I go out. People who's been like in this hybrid situation. So virtual, yes, is the second best. I think if we don't have resources, we can do that. So for us, we have some funds in our center. For instance, we could if we find a good a person interested, that we'll have to compete with the Chileans. But we have received a woman from Europe as a postdoc. So we do receive, but they have to compete. But if we have an agreement, I can get, for instance, that one of the fellowship is reserved for the person from an IHCC member cohort, at least one to reserve. so the competition will be inside, and we have funds to pay a very, a monthly stipend that is enough for Chile, but it's not very, it's very, it's in the limit. So if the person have a family, it will be complicated. But how much will be, we didn't calculate, I can do the calculation. If you were to help to increase our payments, so because to double it, something like that. I think maybe Sandra or Laura can calculate. I think it's like 1 million, it's like 20 million. So it will be 20 million will be $20,000, right? 20,000, I think it's like $20,000 what we give the person.
So $20,000 per year, right, Dr. Katarina?
Per year.
Okay, thank you.
But that will include, but the stipend alone will be like 15,000, and the other is for travel and things. Yeah, it's like that per year, and can be 1 or 2 years. I think less than 1 year will not be enough. 2 years, I think, is the ideal. And I have already talked to the director. I am the deputy director, and he agreed in the concept to open us that fund, our part of the fund, to IHCC. But I think we have to make it more attractive for a person. So that I don't know if Laura, you want to add something?
It's difficult. I haven't done any calculation about how much it will cost. And I only know that we can help with food allowance, for instance. We have feasibilities in MAUCO, so we can facilitate accommodation. Yes. But how much it will cost, I really don't have an idea.
So your question, Latifa, is how much it will be for IHCC to complement, right?
Yeah, I mean, we want to know how much you can, pay from your end, and
exactly.
see what we can complement. And this is, of course, we are talking now. We don't have anything for the time being.
It's to propose.
Take it from but at least the willingness is there, and the initiative is there from your end and your team, which we greatly appreciate.
So the least that we can have is to, when we open the proposal for postdocs in the center in Agnes, to send it to the IHCC community with the money that we are with what we can pay for the postdoc, and we can see if there are interest people. So that of course I will do in the next call. That probably will be soon, actually. And what I can commit is that the center will separate one fellowship for IHCC, unless the candidate doesn't cover because there is a selection process.
Okay, thank you so much.
Thank you. It looks like we are okay.
Over to you, Kali, if somebody else has a question.
Yeah, we still have about 5 more minutes. I don't see any questions in the platform, but if anyone again wants to turn on their mic or ask a question or put it in the chat here or in Huva, we can read it from there. Feel free.
Okay. Well, we run too much. we didn't present MAUCO itself because it has been presented, and but I should mention that the description of the cohort is published on also the baseline, so we can maybe put those manuscripts on the seminar. I don't know how to do it. Maybe I can send it to someone. These two manuscripts that will describe the cohort.
Yeah, absolutely.
Okay, to Amanda or let yeah.
Yeah.
Okay, I'll do.
Yeah, okay, thank you. One thing, maybe if nobody is here to ask another question or have comments, maybe next is to have like a detailed proposal on what is accommodation, what needs to be done, what are your priorities, what are your requests, what are the criteria that you are looking for in the young investigator or the postdoc. Then we'll take it from here and we'll see if we can call for compliments for the funding, and at least to launch, if we can launch only 1 or 2 mentorship programs with you, that would be great, and maybe that can plant the seeds for more collaboration and more learning for young investigation and more mentorship program. Thank you so much.
Thank you, Latifa. Thank you very much. Okay.